after 10 weeks, I was able to play 5 rounds of golf. And then during that week, walked almost 50 miles at the location that we were, again, with very little pain, very little swelling. And so extremely thrilled with my ability to do that after a pretty short period of time. James Sturdivant injury, had an ACL total reconstruction probably 25 years ago, and then that led to just wear and tear to where ultimately had bone on my knee, and Dr. Stone said I needed total knee replacement. I had ACL reconstructive surgery, and then ended up needing my meniscus repaired twice in the last 10 years, just from just continued wear and tear. And then summer of 2021, didn't realize it at the time, but actually completely tore my ACL again. Didn't even know that until I saw Dr. Stone. And at that time he said I needed total knee replacement, and that basically I had a worn out knee. So it was time, and was having swelling, pain from activity, was still able to do a lot of the things I wanted to do, but with limitations, not at the level of performance that I wanted. And then also, there's consequences if I had too much activity, then again, swelling and pain from the activities. Well, with the knee replacement, from all the other doctors and surgeons I talked to, it was a drastic change of life. I was not going to be able to do the water sports that I wanted to do. I was not going to be able to return to basketball or running, and just a lot of limitations on life. And so I was looking for an option, hoping that there would be something out there, some type of surgery or option that would get me back to where I left off, so I could return, not only just perform those activities, but do them at a high level and compete. So that was my goal. That's what I was searching for, and I just wasn't finding any answers. In fact, it was I was not going to have any surgeries at all and just continue to live with it. And I was doing exercises and PT and muscle strengthening and balance and trying everything that I could to try to get through it. But I was finding myself exercising more than I was even doing activities to try to maintain, and it was getting pretty frustrating. So coming to the Stone Clinic and meeting Dr. Stone with my appointment, and I flew down here and had the appointment, and he said, we can get you fixed, you're a perfect candidate. Extremely encouraging. So I did the 2 weeks of rehab here, which was incredibly helpful, just to give me an idea of what to do and what to expect, because I didn't know. And just each day coming in, like, okay, you're doing good, you need to keep working on this. And then just giving me the blueprint for the next couple months of what I need to do. And Dr. Stone said, I did my part, now it's time for you to do yours. And so I took that seriously, and I've really worked hard at my rehab. It's been hard. It felt like it was going slow. Of course, 90 days is not a super long recovery, but it's felt like a long time. But I'm, at 90 days, I don't really feel like I have any restrictions from just basic life, from walking to playing golf to work to all of that. I'm not at the point where I'm able to perform sports yet, basketball and water sports. But again, it's only been 90 days, and I'm still working towards that. But at this point, it's feeling pretty good. Dr. Stone says I'm doing great. I've still got some swelling that I need to work on to get mitigated, but I think I'm on track. After 10 weeks, I was able to play 5 rounds of golf, and then during that week, walked almost 50 miles at the location that we were, again, with very little pain, very little swelling, and so extremely thrilled with my ability to do that after a pretty short period of time. So I want to be able to wakeboard. That's one of the things that my family does. I've got a boat, and we not only wakeboard but wake surf. Wake surf is not as extreme. Wakeboarding is extreme, and we've been doing it for probably 10 or 12 years. And so wakeboarding, doing acrobats from wake to wake and jumping and getting 10 feet in the air behind the boat and landing, and that's a little bit on the extreme side. That's how I tore my ACL in 2021, and so I want to get back to doing that. And then playing basketball. I do play in competitive tournaments in Spokane, Washington. They have a tournament every year, largest 3-on-3 in the world. I play in tournaments locally. So getting back to not just playing basketball, but also playing in tournaments and wakeboarding and doing some more high impact type of activities. And then I do other activities such as archery, hunting, and so hiking hills and mountains and packing, weight on my back while walking on uneven terrain, or other goals of mine. So those would be more extreme things I want to get to. But as far as like the basics of just playing golf and walking and going up and down stairs, like after 3 months, 90 days, that right now is not hard. That's already done. That box checked. Now it's getting to, the next phase of the next 90 days or the next 6 months to where I can return back to my sports.